Calling to order the Public Safety Committee meeting of December the 18th, 2023, 5:30 p.m. Before we start, I just wanted to thank our outgoing chairperson for the public safety, Councilor Ed Shermer, our deputy mayor, who served on this committee and was the chair for 4 years. And these are big shoes to fill for me, and I hope I can do justice to what he did for this committee and what he did by serving this town the way he did. So again, I just want to start with thanking Councilor Ed Sherman here. And now we'll move to approval of minutes. Do I have a motion to approve the minutes?
So moved.
Can I get a second?
Me? I'll second it.
Thank you. Any discussion? All right,
Ready to vote?
approved.
Aye.
Aye. All in favor?
I wasn't here, so.
Okay.
Oh, yeah.
So one abstain,
Yep.
two approved.
Okay.
All right. Next item on the agenda is public comments, and I don't have any comments in the online version here. At least I don't see it up here, but I do think we have a few people who want to make a public comment. If you want to come up to the podium.
Rich Pauls, Policio, 8 Washington Street, Rocky Hill, past chairperson of the Rocky Hill Town Council Public Safety Committee. As I brought the attention to the full council 2 weeks ago in regards to the lack of safety at the polls at District 2, the Mosier School, the elderly and people with disabilities had a very difficult time that day, the election day, to get up over that cement curb, as a lot of the candidates and now elected officials witnessed. So I would recommend the town manager and the Public Safety Committee look into the situation and possibly strongly suggest that move it back, District 2, to the Town Hall Community Center. Thank you very much, Mr. Chairperson.
Thank you so much. Thanks for your comment. Since we don't have any old business on the agenda, we'll move to new business. And actually, we'll do the, actually, I wanted to do can we move the new business up? Can I get a motion to move the new business up for discussion, road safety, community development director?
Sure thing, Mr. Chairman. Move to amend the agenda to take the new business item. So let me get it here. Concerning discussion of road safety by the community development director, that we move that to the point in the agenda where we are right now, immediately before departmental updates.
Thank you. Can I get a second,
I'll
please?
second.
Thank you. All in favor?
Aye.
Aye.
Well, that was a pleasant surprise. Thank you. For the record, Steve Soplak, Director of Community Development and Public Works, and I'm here to speak a little bit to the roads and our road safety. I got my notes here. So first of all, I want to say our roads are in terrific shape. I just got our latest pavement condition index, and that's on a scale of 1 to 100. And before any of our referendums started, we were in the 60s for pavement condition, and today we're at 86.6, and our consultant said, the gentleman I spoke to, that's the highest you've seen of any town. So we should be proud of that fact. The referendum has touched just about every single road in town except for about a dozen, and hopefully that'll be next year's, we'll be hitting those next year. So our roads are, like I said, our roads are in great shape. We have 62.17 miles of town-owned road, and the remainder will be state or I guess it'll be state, interstate. Next, speed limits. Speed limits are state statute, 25 miles an hour minimum. You can get it lowered for special conditions, which we did this year in the old lake area, so Lake and Lakeview, and those we were able to get those posted at 15. But in general, they don't go below 25. And they depend on the function of the road. And the function of the roads are you have a local road, a collector road, arterial road, and an arterial road can be anything from, say, a Sally Steen Highway to the interstate is also considered arterial, but we call them a freeway. And then when we have those, we have different design criteria. So a local road, our roads will have tighter corners than, say, a collector road, which will have, tighter corners than a arterial road. And also you have different design speeds. So if you're seeing a crash pattern for some reason, chances are going to be due to operator error, not road, because all our roads are designed to specific standards. So then, from there, I went into the Connecticut Crash Repository, which is hosted by the University of Connecticut. And correct me if I'm wrong, Chief, but every night the PD can upload their data to the site, and it gets processed. I think it's monthly, because when I was looking at the reports, the latest date that they run through is October 31st. So it seems like they ran it in somewhere in November, probably waiting for a December run now. Am I correct on you can upload that data daily?
Every time we approve an accident report, it goes through the state
goes right.
DOT and then to your repository there.
All right. So, and from that data, our standard in the industry is we look back 3 years for road design, crash history. So in Rocky Hill, over the past 3 years, there have been 1,710 crashes. I know it sounds like a lot, but of those crashes, 208 have been on town roads. The remainder are on state roads, mostly on I-91. There's 761 accidents in 3 years on I-91. Do the math. That's 70% of the days there's an accident on I-91. So it's like every 18 hours or so, there's an accident. Our roads, so that's 12% of the crashes happen on our local roads. And I looked at the surrounding towns, and it's hard to say because they have more mileage of roads. So if I do very rudimentary crash by mile, we have 3.35 crashes per mile. Only Newington is better, and they have 244 miles of road. So, and I looked at Berlin, Cromwell, Wethersfield, so they're all a little bit higher. So I know you like data. Worst month seems to be January. Worst day is Tuesday. The time of day is usually between 3 and 5. Conditions, almost 84% of the time it's on a dry day. 80% of the time it's a clear day, no weather conditions. 70% of the time it's during the day. Contributing factors, only less than 5% is due to weather, ice, that kind of thing. 86% is there are no contributing factors. It's not weather, it's not whatever, it's just an accident. And then this is we'll give you an idea about intersections. So at intersections, 34% of the accidents are in intersections, and 14% are at junctions. When they consider junctions something like a driveway, other kind of mergers that aren't at a two-way, three-way, or four-way intersection. And 40% of those intersections or driveways have a stop control. So 40% of the accidents are happening at either an area that has a stoplight or a stop sign, or somebody like a crossing guard or somebody stopping traffic. 40%.
In town?
In town, yeah. 40% are happening at stop signs or traffic lights.
So can I ask you something? So what will be that number for surrounding towns, for comparable surrounding towns? Like, do you think that's...
I did not look at the other towns. It's going to be similar. It's all going to be similar. Just because you put up a stop sign or traffic, some kind of traffic device like that doesn't mean you're going to stop accidents. Studies find they cause accidents. That's why you see roundabouts coming back.
Is this data for this year only, the 40% number, or is it going back?
3 years.
3
years.
Thank you.
Yep. And then to kind of really shine some light on most accidents are operator error. 92% of the time it's been on a straight section of road. 77% of the time it's been on a level section of road, so it has nothing to do with the road geometry, blind corners and all that. So it's a lot of operator error. Collisions. This is one I know you guys want to hear. So this goes back, like I said, to Halloween. So as of Halloween, there were 4 bike strikes in Rocky Hill, 2 on town roads in the past 3 years. There were 9 pedestrian strikes, none on town roads. Now, I know there's been one since. There's been 11 animal strikes. And then the data also gives you injury statistics. In the past 3 years, townwide, there were 5 fatalities, none on town roads, all on state roads. And they also report no injuries. So 170 of the 208 accidents had no injuries reported. And then they also give in this report the worst roads. And it's interesting to note that of these worst roads, I'm not going to give you the state roads, just the town roads. Of these town roads that are worst, they list 9. 7 of them used to be state roads. That would be Dividend Road, Town Line Road, Old Main, Hayes, Parsonage, Brook, Orchard, Gilbert, and Cold Spring. All but Town Line and Cold Spring were state roads. All are collector roads. They're designed to carry a higher volume of traffic at a higher speed. Dividend Road has the highest amount, 22 in the past 3 years, 17 at intersections, 12 of those at Pratt Street. We've been going back and forth since 1981 on a solution for Pratt Street. Since I've been here, we put in the flashing beacon, optical speed bars. We've looked at the report from 1981. That was to lower the road. To lower the road, you also have to lower all the utilities to get below frost. You have to build walls. You have the cemetery, so you don't want to displace any bodies. That's another horror story. The price in 1981 was $207,000. The price today is going to be about $1.5 million to fix that. One of the ideas is to close the road, that section of Dividend Road at Pratt Street, to enhance the green and kind of link it to the new development going on, which is a great idea, but I'm not sure about that sight line. I think you'll still have accidents, people going into that what will be now a park. So it's something we got to consider. So Town Line kind of, not Town Line, but Old Main kind of jumped out at me. I was kind of curious of why there's, more accidents on that road. And what I found was, of the 10 in 3 years, 4 were at intersections, and then 4 were due to driver error, like a side swipe, trying to pass somebody where you're not supposed to pass. Somebody was taking a left-hand turn in their driveway and they got rear-ended, but none of it was due to there was only one weather-related. They slid on ice, hit a pole. But really, it's again, driver error. It's not the roads themselves. So, except that one case, as I said, at Pratt and Dividend, that is an issue we've been working on since when I was in high school. That's all I have for you. Any questions?
Bill, any questions?
Yeah, so Steve, specific to that recent incident on Marshall Road, and there was reference somewhere, I don't know if it's factual or not, but there've been like 3 accidents the third time that a car has failed to negotiate that curve and landed on the same property. We have this one that hit the house, but supposedly there were 2 priors. I don't know if that's just rumor, if that's factual. Maybe
I did not search that particular location. I don't know. Maybe Chief has an idea. What I've heard is that car, the last one was impaired driver.
Correct.
And they launched that car like 60 feet in the air. That's how he was going that fast to launch it, to sail 60 feet into the house. So that was,
Okay.
again, driver error.
Okay. What jumped out at me was, again, that report that was a third time.
I'd have to look.
Which might suggest, that there's something about the geometry there that
Well, it's-
perhaps needs to be
It is
addressed.
very sharp. It is very sharp. But again, if you're doing this posted speed limit, it should be fine. Those roads are designed for 30-mile-an-hour design speed. Posted speed limit's 25. If you're doing 25, you can negotiate that corner.
Okay. Does the town have a list of priorities? I mean, you identified a number of roads and that are kind of raise a recurring issue. Do we have any in the pipeline that are identified for possible reconfiguration or any any softening,
Nope.
speed softening measures?
O-
No.
Only that dividend Pratt. That's the only one that's really a problem.
Okay.
We don't have history at really any of these other locations. I mean, even, it's a state road, but those S corners on Elm Street, you'd think that that'd be an issue. They're very tight. No accident history there. Very little. So,
Okay, thank you.
Councilor Villa.
Thank you for putting this all together and bringing us up to speed on this. And as you point out, it seems like probably 99% is driver error. So, and then that one road area that you're looking at, you tried to do things over the years, so thanks for doing that for us.
yeah, you're welcome. Like I said, that's been on the radar for, what's that, 40 years now? 40-plus years?
So, yeah, I mean, Steve, the question I have for you is, so 40% of these things happen on intersections and stop signs and things like that, right? So I'm just thinking there are two aspects, right? The engineering piece, which Councilor Sullivan covered, right? And you think you are covered there, right? From the engineering piece, you don't see any geometrical problems?
No, because usually what it is one car's waiting.
Right.
One car goes through and they pull out and they misjudge.
Yeah,
It has-
that's what, so
Yeah.
that brings me to the second point, which you keep talking about in your presentation, which is driver error. How much of that is an error? How much of it is just not following the law and like being over speed limit?
I can help you there.
Yeah.
I don't have his study on it, but we do occasionally, when we look at the causation of factors in our accidents, and of the ones you've mentioned, and it's probably in there somewhere, as I've looked at the same
There
report.
is, it's hard to find.
More than 60%, again, this is anecdotal, so don't hold me to it, but 60-70% are following too closely, someone rendering another car. Very low speed impact, someone stops at a stop sign, begins to creep, gets rear-ended. Somebody at a traffic light is distracted, hits somebody at a light. Not to say we don't have turning or intersectional accidents where you're meeting cars at 90-degree angles, those certainly do happen, but they're well infrequent compared to just the normal, oops, I'm on the phone, oops, I wasn't paying attention, and you get the, get the rear end accident, 14,240. I know Frank could probably fill you in on the statute. It's very familiar to us.
So, Chief, my question is like, so just focusing there for a moment, like, is there a way to, and I know we have touched on this before, but things like those speed, flashing speed things, right? Like, I don't know what the technical term for those is, which says like you're driving at 40 and there's a 25 speed zone.
So-
The big speedometers.
Yeah.
Yeah.
I mean, I don't know what the technical term for that is.
We find that people race those to see how fast they can go.
Well, we've actually got ahead of that where we turn them off after like 10 miles over the speed limit
Yeah.
so they can't try to race them.
Yeah.
But when we've done our studies, and we work with Steve's office quite a bit, and you can explain the calculation of the 85%, we don't find that speed a lot of times is a factor, although we have cars exceeding the speed limit, certainly. When you're looking at that average speed, talking about the proper speed limit, we tend to be within the DOT threshold for that 85% mark more times than not. While we do get speed complaints, and there are cars that do 60 and 55 on Brook Street or other streets like that, as a statistical average,
It's not the norm.
Correct.
Yeah.
Yeah, I'm just trying to find like a solution space here, like somewhere like.
See,
we can-
I don't know
we
what
can
the
go. Like,
solution-
that's all I'm trying to do. I don't know if there are any ideas, creative ideas to like curb some of this, but
Well, I mean, there's not, from an enforcement perspective, there is not a whole lot that any police officer can do for a rear-ender. I mean, maybe we enforce cell phone violations, and we do that with grants, et cetera, but 60% of our crashes, if we hold to that number, are someone tapping the back of another car. You're not going to post an officer at an intersection to look for someone maybe coming up on the light too closely. So we try to address those intersectional red lights and speed where we have those problems and try to be visible in those areas. And that's kind of how what we focus on is some of the data or the complaints that we receive, and then we go to those areas and saturate it to try to slow people down and give them that visible deterrent that is helpful. As far as environmental design and things of that nature, those are things we can talk about down the line, but how effective they would be and what studies would show, I don't have enough data right now to
I mean,
support that.
yeah, the geometry of our roads are all been designed to a standard, and it is to a specific design speed. Like I said, 30, and you're supposed to be driving 25. So if you do that, you should be fine, unless it's an environmental condition, possibly.
So by the way, talking about that one incident on the third time it got hit, right? That's just like pure like bad luck.
Well, that was somebody who was impaired and just flying. I don't know what the speed was, but from what my understanding of our building official, he said they hit the curb and they literally flew through the air into the house. So
Yeah,
you're
I
going
mean,
like
the
75, 80 miles an hour, probably.
The only reason I'm talking about that particular incident and not to like, take this like down a rabbit hole is like just that raised the concern about, hey, are we doing enough for, like if somebody's getting hit the third time, it's just, anybody will like question that, I think. I mean, you would have questioned it probably.
Yeah, I mean, that's the first time I've ever heard that house has been hit. I've never heard that before, so.
Yeah.
Well, it was on Facebook, so it must be true.
Exactly. Facebook is always true, yeah.
I mean, that crash is being investigated and likely lead to an arrest. And having gone back and looked at some of the surveillance photos, that car was inside the pool
Yeah.
before the accident happened and left the pool area and drove down the road so it's a very unique set of circumstances there.
Sure. Thank you. One last thing, and I'm raising this as like a potential solution, if you will, like, or at least like moving towards a solution. I don't know if we can do awareness drives and things like that for 40% of the accidents which are on these intersections. I mean, that seems like if you can control those, those numbers can come down dramatically. Like, I mean, our overall numbers probably for town, 40% is a big chunk, right? And
Well, it's just 40% are at those locations, and it's just a statistic, and that's where they're gonna happen. It's kind of like a fault line somewhere, and an earthquake's gonna happen on the fault line. The accidents are usually gonna happen at an intersection. Correct me
But do
if
you
I'm
think
wrong.
like those kind of awareness campaigns like help, Chief? Like I don't know if can we do something like in the new year, like, or I don't know, like if that will help. I know you talked about presence, which should help, I think.
I think the biggest campaign would be the cell phone campaign that usually comes out with federal funding or local state funding. While we can't always prove someone's on the cell phone, that's where these distractions are coming from.
Sure.
So we do participate in that program yearly, and when those funds do come around. But as far as a campaign, I mean, we can remind people, can put out an advertisement on Facebook, but you're not going to. An advertisement's probably not going to make someone not pick up the phone to talk to their son or daughter or their wife when they're calling. It's just a generation that we live in at this point. So enforcing that and being visible and getting them to put their phones down at those areas is helpful, but we're never going to see the accidents completely go away. It's impossible.
Yeah, no, of course. And sounds like enforcement is the way you want to approach
Visibility
this.
and proper enforcement, sure.
I mean, they call it an accident for a reason. Sometimes it's just nobody's fault. You might not even be distracted. My wife was trying to take a left into a driveway, and just the car came on her really quick, and she thought she had a better gap. It was nobody's fault. She misjudged. So it's an accident. They call it an accident for a reason. If she waited, she wouldn't have the accident, but she thought she had the gap. Misjudged it, how fast the other car was coming. You just don't know.
Okay, no.
So,
Any other questions? Anyone? Okay.
Thanks.
all right, thanks.
Thank you so much, Steve. All right, so moving back to our regular agenda items, we'll move on to departmental updates. Go with fire first. I don't see the chief here, though, so I think he was traveling. Ray, do you have any?
Yeah, the
any-
chief, he's been out of state for over a week now.
Sure.
Yeah.
Yeah. So I did receive the report. It was attached in the packet. So we'll skip over the verbal update, and you'll move to emergency management, who is again, Chief Gary. So I think we will skip that as well tonight, and we'll move to ambulance, depending on who wants to go first, Etna or Rocky Hill volunteer.
Doesn't bother me, it's fine. So far, for October, we did 124 calls, in November, 129. Year-to-date for Rocky Hill, we did 1,309 calls for service. Our average response time is, for hot calls is 7 minutes and 11 seconds, and cold is 8:43. The top 5 calls that we've been tracking and stuff are falls, the respiratory, shortness of breath, sick person, trauma, and medical evaluation or psychiatric. We've had 1 cardiac arrest in October and 1 and 2 in November, which makes it 13 year-to-date. 9 of those actually got transported to the hospital. We had 1 opioid-related incident, which was in November, which is the year-to-date, which is 3. Our staffing members we're up to 37 regular members. We had 4 probationary and 5 associate members. We have another EMT class starting in February. CPR, our training classes have been the mandatory for October and November. CPR and AED and the Lucas training. And we've done a bunch of community engagements with the soccer tournament, the Myrtle Stevens truck or treat, the high school football standbys, the North Pole Express, the gift drop-off for the kids. We're also delivering food on the holidays for Thanksgiving, and we also covered the Rocky Hill road race at the VA.
Okay, thank you.
No questions.
On the
Thank you,
summary.
Brian.
No questions, thank you.
So we started this executive summary thing. What do you think, Chief Goodrich? Like, is it working for you, like doing the summary? I think
The summary.
you used it today, I think.
Yep. Once we get all our kinks worked out, it'll flow a little easier.
Yeah, good.
This is the first month, so.
This first month, okay. And then the other thing I wanted to ask you was, what is the proportion of calls between you and the Aetna is like still similar? Like, I think it was 60-40 or something of that nature, in that ballpark?
Yeah, it's about right, yep.
Okay, all right. All right, I think we move on to the Aetna report. Thank you.
How you doing? For the record, my name's David Kemp. I'm the Clinical Operations Manager for Aetna Ambulance. So again, this is kind of the first stab at the executive summary. Hopefully breaks it down and makes it a little bit simpler for you guys to follow along. So November, we had 289 responses that resulted in 194 transports. Year to date, we've done 2,995 to 2,010 transports, so that gives us around a 70% transport ratio. Our on-time performance to scenes is 94% with an average hot response time of 6 minutes and 31 seconds. The cardiac arrests and opiate encounters, so far this year there have been 41 cardiac arrests in the town, 21 with culminating in 21 transports and 20 presumptions. Opiate-related encounters, we've had 15, including 3 last month. I believe one of those overdoses at least was suspected to be fatal. I'm not 100% sure on that, but that's at least what I'm hearing. We'll have to wait to get that back from DPH. The top 5 reasons for transport, we had sick person. Fall has always been kind of the top one in the town here. Difficulty breathing, MVA, and unconscious syncope. One thing I did just want to bring up real quick, because it continues to be a very high number, and it's something that the town can be very proud of, is the survival rate for cardiac arrests in the town of Rocky Hill is 22.2%, which is compared to 7.8% overall for all of Aetna's population. That includes Wethersfield and South End of Hartford. The witness cardiac arrest in the town of Rocky Hill is 42.9% chance of survival, which is absolutely incredible and something, again, to be very proud of. And I think that correlates with the CPR bystander rate here. That is 58%, which is double of the average CPR rate than any other town. And I think, again, this is something that's really cool. I think it's related to the dispatchers getting on with them and understanding what's going on, but I also think it's a tribute to getting all the services there between the police department, the ambulance, as well as Aetna, to get to these people, to get them a high level of care in a quick fashion and getting them, the help that they need. There's also been the highest rate of public AED use here at 25%, which can always be better, I think, but, you have to have the AED where the people are, and that's not always, going to be something
Dave,
that
can
can
you
happen.
talk about the AED? What is that?
That is
For our civilians.
Yes, absolutely. So it's an automated external defibrillator. So there's probably one somewhere in this building here where you can basically open it up, and a bystander it'll give you all the prompts, put the pads on, start CPR. It'll then defibrillate the patient if they're found to be in a lethal rhythm, and hopefully correct that rhythm and help correct that earlier before, first responders can get on scene, which is one of the key components to survival as far as the cardiac arrest. Does that make sense,
Yes,
Counselor?
it does. Thank you.
So that was really exciting news. As far as other activities that we've been doing, we have been meeting with some key state legislators and local municipal leaders to discuss some of the kind of ongoing initiatives. One of the big ones that I think, at least to give you guys peripheral awareness about, is this Medicaid funding. So the governor, it was actually promised to us it was going to be $5 million across, not just to Aetna, it was to all ambulance services across the state. It was promised in 2023. As things happen, that was cut from the budget, so it's now in the 2024 budget. So we're really trying to get, and we've met with Carrie Baker, or at least with, for a local perspective, to kind of make sure that that stays in to help get the reimbursement rates higher, because Medicaid has not had an increase in about 20 years. So this would be a very sizable increase for us to help kind of level the playing field as far as getting reimbursements to both Rocky Hill Ambulance and to Aetna Ambulance itself. Mobile integrated health is still moving forward. I think there's a lot of potential there. As far as leveraging, we have a lot of EMTs and paramedics across the state as another, not to replace the visiting nurses, but to be able to supplement that to try to reduce some of these hospital patients that are discharged from the hospital and then have these returns. I think there's a way to do that. That's something to keep an eye on, and something that would be available both through Rocky Hill Ambulance as well as Aetna. As that thing progresses, that's probably, we're looking at a 2 to 3 year out. I know that Nancy has participated in a program down at Yale, so stay tuned with that. And then there's some other things in there that goes in to talk about EMS deserts and some of the problems that rural communities are having right now. So we say that there's lots of EMTs and paramedics, but for some reason in some of these towns it's really not happening, and they're having some gaps in services. We're fortunate to not have that here in the town of Rocky Hill, but is something at least peripherally be aware of, that there have been some issues. So with that, that's my executive summary. I hope I summated that well, but I'll be staying ready for questions.
No questions. Thanks, Dave.
You're welcome.
No questions, thank you.
So, Dave, I do have questions for you, and sharing. Thanks for sharing these charts with me earlier, and with the town manager as well. So, on cardiac arrest, and this is just for my own understanding. So, on the first, do you know which one I'm talking about now? The line and the bar chart. Okay. So, on January data point, there is no 21 data in there, I think. Is there a reason for that? There is a bar missing. It could be just.
Let me just make sure I get to the right page.
Page
So you're talking 2021, the cardiac arrest, the one that's got the bar chart with the vertical, with the average line there?
Yeah.
So the reason that is blank is because it's zero. There was no data for that.
No data for, so 21, the cardiac arrest was zero? Like,
Was zero.
oh, wow.
Yeah.
Okay.
There was a very large lull in all calls throughout kind of, this is now towards the tail end of COVID as things started to kind of go back to normal. So that I believe is why you have no data there.
Okay, that's great. And then one clarifying question for myself again. That average line, which is really helpful, by the way, monthly average, the green line, is that the average of the 3 years for that month?
Correct.
Okay. Yeah, okay, that makes sense. So that average line it's actually, we are at a lower point in 2023 than the average for pretty much every month.
Yeah, it's been down across the board, and we've seen that globally as well, not just here.
Okay. And one last question again, for my knowledge, what is ACLS? What is
Sure. And
ACLS versus DOA?
Yeah, so I anticipated that question because I've had that on there for a while, but I think I had so many graphs I was able to distract you from it. So what DOA is, it's kind of morbid, but it means dead on arrival. So basically, the patient was in a condition that no resuscitation attempt, whether you're in the hospital or who you had come to help you, there was not going to be a successful resuscitation. ACLS means that the paramedic on scene and the ambulance crew on scene actually attempted a resuscitation, utilizing everything that was available to them, but unfortunately they were not able to get a sustainable rhythm back for the patient, so they were presumed dead on scene. So again, morbid, but that is what those two things indicate.
I see. So okay. So that's not a good outcome like in the middle one, like the orange bar.
Yeah, and it's one of those things too. There's certainly been a shift, and I know Chief Goodrich has been in EMS for a while, and it certainly was a paramedic for a while. We used to just transport all cardiac arrests, and I would say probably in the last probably 7 to 8 years has really been a focus on not transporting patients when they're in active cardiac arrest. And the reason why is there's a couple things. So doing CPR in the back of a moving ambulance is inherently really dangerous. You're standing up, you don't really have anything to secure you. If it needs to happen, it can, you do it and you make it happen, but it's preferred to not do that. There are certainly some solutions to that, like Lucas devices, which the Rocky Hill Ambulance does and is able to provide, which is a safe way to do it because it's a really cool device. If you've never seen it, I suggest going down and actually taking a look at it. The other part of that that equation is that attempted CPR, unless you have a device in a moving ambulance, is very ineffective. You're not able to compress to the depth that you would need to effectively move blood throughout the body. So it really becomes futile, and it's not really benefiting the patient. So we've really shifted to this treating on scene and trying really everything that we have available, which is, outside of going to a surgical room, everything that the hospital is going to have. And we try, we'll throw everything at them, and if we can't really get any improvement, we'll get on the phone with the doctor and talk to them, where we're at. And then based on that conversation, we'll either continue resuscitative efforts by transporting or we'll terminate on scene.
Excellent. Now, thank you very much. And so for the charts themselves, as we have talked about before, I think you have one set of charts, and Chief Goodrich's team has one set of charts. Just make sure we align going forward in January. I know your guys are already working on it, so just to get some kind of alignment for everyone here, I guess, and the public, so that we are all looking at the same information. Again, the data does not have to be combined or anything, but at least the alignment is there in terms of what you're producing. So, Chief Goodrich, are we aligned on that? Mm-hmm. Okay, great. Thank you very much for putting this together, and I think we are making a lot of progress. So, thank you.
All right, thank you.
Unless somebody has questions, any follow-ups?
I didn't know if I could just say something. I don't know if
Please.
you got my text message.
Oh, I didn't.
I think it would be wonderful if Rocky Hill Ambulance could demonstrate the Lucas at one of our future meetings. So you can see how, when Dave Kemp talked about using the Lucas in the back of an ambulance, we do that for long transports, especially because it wears you out, and as he says, it's very dangerous to do CPR in the back of a moving vehicle. So if we could come and demonstrate that, when it's convenient.
Yeah, I'm totally open to that. The counselors probably are. If Ray, it's okay with. Oh, yeah.
Okay.
What type of device is it?
Thank you.
What does it do?
It's a Lucas device, and what it does is you put a board behind the person's back, and then this two arms clip on the board that are on the sides, and then it comes up, and they have a mechanical arm that comes down, and you put it in the correct position. You can set the depth for the CPR. For a child, a heavy-set guy like myself, a skinnier guy like you, we have different, it's got to meet certain ratios of CPR of how much depth and how many, and you can set the timer for how many compressions a minute you're supposed to give, all the stuff like that. So if I'm doing it and I'm starting out and I'm supposed to give 30 a minute, and then we're 10 minutes in, I'm probably down to about 18 to 20 by the time I'm so tired I can't. But the machine just keeps going and gives continuous, perfect CPR, the compressions and everything, right with the settings all set.
Great, thank you.
Thank you so much for that detail. Moving on to the police report, Chief Clark. Thank you.
Good evening. For this month of November, we have 3,041 calls for service, 30 criminal arrests, 5 DUIs. We've been very busy with hiring and recruiting, recently having made 3 conditional offers to prospective certified officers from regional police departments that we're conducting backgrounds on now to fill 3 vacancies that we have. We're currently interviewing certified dispatcher candidates. We bring 2 more coming in next week, and also actively advertising for the animal control part-time position, which closes at the end of the month. Of note, we are seeing, it's a metric that I will add to our PowerPoint here down the line as I get some data. But one thing of note is we're seeing a big increase in the number of FOI requests for digital evidence and records, which require redactions. and an officer currently assigned to do that. So really, we're trying to quantify the amount of time, but to say it's an average about 3 hours a day is probably fair right now, but I'm pretty convinced that when we start tracking this as we are now, I can give you some charts. We're going to see it in real time how it's happening, but it's highly demanding of our staff right now. For those requests, community engagement, happy to announce that between two individual events that our officers have and our staff have raised over almost $8,500 between the Special Olympics and donations to Human Resources. And I'm very proud of them for their participation in both these events. And both monies were donated back to Special Olympics and Human Resources just last week, which has been fantastic for them and a great opportunity to participate in those things. And of major note, we had a Shell station car had taken off and ended up on Route 3. You probably saw maybe some of the tidbits on the news. That investigation is active. We have identified the two suspects, and we plan on having an arrest warrant to be processed over at the GA within the next week or two.
Great. Thank you so much. Councilor O'Sullivan?
Yes, thank you. You know, Chief, every report starts with the number of calls for service, which tends to average about 100 a day. And just here's a really basic question. What qualifies as a call for service? Because you have about 3,000
Sure.
per month. Number of arrests is 30 and other types of events. So what accounts for the bulk of that, and what does it actually consist of?
So the way we track the calls for services, anytime an officer is either on a self-initiated piece of activity, proactive activity, or in fact receives a call from the community. So it's essentially whenever an officer is committed to an incident, whether that be a follow-up to a case, a traffic stop, a residential check, business check, things of that nature.
Okay. So if a 911 call or even a routine call is received at headquarters, does that count, or only if it generates in turn a dispatch of an officer to a situation?
So the call, what you're seeing is you're seeing where we started with our CFS, call for service number, at the start of the month and at the end of the month, and we're left with the yield of the number of incidents generated in our computer system. I mean, it could be broken down, certainly, but trying to give you a broad overview of how many minutes, times, or incidents our officers are assigned to something throughout the course of a month.
So out of those 3,000 or so, what would be the biggest category, or some of the biggest categories by way of example?
I think if you look at our day, I mean, larcenies are certainly been busy lately. Follow-ups to cases where they're coming off the road and putting themselves back onto a call and investigating a case that, as an example, like the Shell station, the officer in charge of that would come off the line, put himself and activate himself on that on the CAD, and be working on that individual in that incident during that length of time. So while he's not stopping cars and he's not out doing checks, he's committed to that incident for that day. So you're getting a trigger for an incident as it's reported here.
And is that each day, is that logged as a separate call for service, or how does that work? Or if he's making multiple visits and interviewing different witnesses, how does that?
So every time, so in our system, we have case numbers, we have incident numbers. So each call would generate a case number, and sometimes the case revolves follow-up, sometimes it does not. If it's simply we'll say a residential check, that would be just an incident, open, close, triggers a number, but it's accounting for the officer's time. And if it's a criminal event, it generates a case number wherever an officer writes the report, has an actual piece of paper connected to it. So they're the same, but they're different. So if we were to take a look at how many reports we have written, would be different than that of the calls for service. We're really trying to lump them in together to give you kind of a roundabout full number of time committed or incidents that are generated.
So you got one incident that generates multiple calls for service then, depending upon what
It's-
types of follow-up activities there are?
Possibly. Yes, correct. I mean, if there's follow-up. In most cases, there's, depending on the case of the officer and how many times they reactivate that incident, you may see that. Generally, we put the officer on a follow-up where we're tracking more time. We have another report where we actually can track the amount of hours and time on certain calls too. But in general, what you're seeing is kind of as we tick a new number, as we punch a number in the system, you're getting it reported here. If you're looking for something different or more specific, I can break that down pretty much by any kind of call type you want. But there's a lot of call types. You'd have to talk offline about what you're looking for in specific. Like you want to know how many larceny investigations, how many lockouts, how many sick calls, and we can break it down any way you'd like to.
Okay, thanks. And just on an entirely different topic, you talked about a high volume of Freedom of Information Act demands and response time. Is there some, can you provide a context for that? Is it all the same person or group of people, one particular investigation going on, or you have any backstory for what's going on
Sure.
there?
So since the police accountability bill with the requirement to have body cams, and additionally some legislative changes to interviews of suspects, we are creating a volume of masses of video evidence for every call. And what's happening now is it's become commonplace for the complainants, the victims, the lawyers, the courts to be contacting us to get those files pulled. Going to the court's pretty easy because we just check them off and we send them to a secure mailing. But if anyone in the room or any member of the public were to ask for those files, we have to go through each individual video and redact a piece of information or data or faces that cannot be released to the public, particularly if it involves victims of crimes.
But most of these demands are really discovery
Correct.
by the parties in the case.
Generally, sometimes it's the media too, and sometimes it's just random members of the public who want to see what we've been doing for the last 2 or 3 months. You know,
Great, thank you.
no problem.
Councilor Wheeler.
I see you have 3 conditional offers. Are we losing officers, or where are these positions going to be?
So of the 3 positions, 1 is being backfilled for the SRO position that was created in last year's budget. We had to pull, we assigned an officer back in October to the schools after the process and selection process. So he's come off the road. Now we have to fill his spot back for that budgeted position. The second position is the chief's position. Chief Custer, when he left, has not been replaced. And recently, we had an officer leave for East Hartford Police Department about a month ago, looking for another opportunity there. So we have 3 current vacancies.
Thank you.
So all are backfills, essentially.
Correct.
Essentially,
I mean, the SRO would be a new position created.
Sure. Yeah, the SRO is the new one, and the other 2 are, one is,
Retirements and resignation.
and, yeah, attrition.
Correct.
All right. So, first of all, thanks for putting this together. I think this is very helpful. The executive summary part, I think it makes it easier for me at least, and I'm speaking for myself. I hope it helps other councilors as well. But one thing I wanted to ask you, Chief Glad, was in terms of the infraction issued, and now I'm going to like the slide where you have everything summarized, right? Like the table itself, right? Those numbers seem to be down. I mean, it's a good thing that we have half the DUIs or less than half, probably 40%. Like it's like 28 to 78 if you compare it from the last year. But I'm just, again, in terms of like good news, this could be a good news story, or is it we are enforcing less?
You know, without sitting down and really analyzing the trend, it would be really remiss of me to give you a response. I mean, what I can tell you is that we have a group of commanders now, our lieutenants, one in an acting position who's just filling in temporarily. We have 1 lieutenant who is in process of winding down for retirement and followed by a second. So my goal for this year, certainly it's on my radar, is to, when we make these new, we have 2 promotions coming up for the position of lieutenant, provided Lieutenant Phelps retires in April, as well as 2 prospective sergeants promotions. And it'd be a really good time to kind of reset the expectations and having new division commanders and review the data as to a root cause. Like it'd be irresponsible for me to respond to.
No, that's fair.
Certainly
That's fair.
It's not missed. We spoke about this with Lieutenant Gutzfeld the other day, about kind of taking a holistic view of the entire year, looking at the activity that each officer has brought to the table, and analyzing whether it's met his expectations or ours together. And if we're missing the mark on having standardized expectations, then we're going to fix that. But in addition to that, we have to be mindful that we can't have a quota and be telling people to go out and
No,
get tickets. So there's a
I
nice
would never recommend that. But it just caught my eye because I was looking at the DUI numbers because it was in the summary.
Yeah.
And it really caught my eye that number was like almost 40% of the last year. So I totally understand, like you don't want to answer it right now before you look at all the facts and look at the data. But
I mean,
but thank you. Yeah.
You got it.
Yeah. No worries. Anything else? Actually, I do have one last question, and this is for my curiosity. Like, this is for the training summary you attached. How to read that? Like, you have the training in there. Like, one is just the summary; it's fine. But the second part of it, I was a little.
Yeah. So
I was having difficulty in like actually analyzing that a little bit.
using the snippet tool that
Yeah.
we have, this, what you're looking at, is actually 2 pages of a PDF. So I had to snip the top and then the bottom. They're not on the same page on the report. But what you're looking at is essentially page 1 on the top and the summary that comes out on page 2.
Gotcha.
And the summary you see on top is are the areas of concentration where we get hours for credit for our post certification. So each class, you might go to a class that's 8 hours long, and within that, each of those areas you see there are the concentration hours that we receive credit for during those 8 hours. So there'd be
Okay.
different areas of law and our certification requirements that those apply to. So you're seeing a holistic view of all the different areas that we're required to train in.
That's
Yeah,
great
and,
information.
sorry,
Yeah.
go ahead. Yeah.
Real good.
Yeah, because that, yeah, and then it's by the different levels as well, the dispatcher and the,
Correct, yeah, when we discussed the new format, instead of giving you the entire 9 pages of which
No.
classes, I think this kind of breaks it down into those critical areas that we're required to be in. And really, when you're asking for an officer to maintain their certification, these are the areas you see here that we must train in and receive credit for on a three-year rotating basis.
excellent. No, this is great. Thank you so much for the clarification. Appreciate it. Anything else, any other questions? I don't have any, so I'm just, so let's look at the agenda. What have we got here? I think we already surprised Steve, so he's out. We don't have any other business, Mr. Town Manager?
Schedule?
You have health district?
Actually, we do. Thank you so much. Oh, I didn't see, where is he?
Yeah, it was out of sight, out of mind there, but he's back. Sorry,
I'm so sorry. I'm so sorry. Health District, please. Here we go. How are you?
Hi. Good, good. So welcome to respiratory virus season. Right now, we're really dealing with a lot of respiratory illness within all 4 of our districts, all 4 of the towns in the district, specifically for influenza-like illnesses where we're significantly over the 5-year trend for November. That is something that 7 out of the last 11 months, we've actually been above that 5-year trend. So respiratory diseases and illnesses have been rather sticky this year. And we're really concerned at this point, going into the rest of the holidays. Coming out of Thanksgiving, we actually saw quite a big spike in respiratory illnesses, both influenza and respiratory syncytial virus. Saw spikes in both of those. Luckily, we have not seen a lot of COVID-19 here recently, but the influenza and RSV have definitely taken a toll. So just reminding folks to definitely wash their hands, stay home if they're sick, get vaccinated where you can, and assuring that you're doing everything that you can to keep you and your families safe and healthy through this through the end of this year and into the new year.
Thank you, Charlie. Any questions, Councilor O'Sullivan? Any questions, Councilor?
Just a question about the RSV. We're hearing a lot about that recently. What is it, or what's it stand for, and how can we
Respiratory syncytial virus. It's a virus that's been around for a long time. You're hearing more about it now than you had previously because they have a treatment for it and a vaccine. And CDC has been tracking this more closely this year than we have in a lot of other years. So we've got good testing to be able to try to figure out where we are with it. But we've really seen a lot of susceptibility to RSV, specifically among traditionally the young and the old. And it can be a very big issue in long-term care facilities where people are exposed. So just making sure that people are doing the basic respiratory precautions really does make a huge difference.
Thank you.
So Charlie, on that, is there widespread vaccination for RSV happening in the nursing homes?
As far as widespread, I can't really say that. I know that recently we've had a couple of minor outbreaks within some long-term care facilities. And one of the reasons why they had that issue was availability of the vaccine, because there is a big push. So nationwide, there's a lot of people that are taking up this particular resource right now, and it can make it hard to find in the short term. So trying to be able to get the vaccine where it's needed has been a little bit of a challenge.
Charlie, one quick thing. What is Epicenter?
Epicenter is actually, it's a system that the state of Connecticut uses to collect data from hospitals and other medical urgent care places. So it collects data and allows us to actually analyze that by town, analyze it by age group. Our epidemiologist, Christine, has been using that for a variety of things, including COVID and a lot of the influenza-like illness. In addition, Epicenter also has data on opioid-related incidents as well. So it really takes a lot of the hospital data and helps us to be able to use it locally. It's a relatively new system, just a few years old. So we're still, kind of figuring out how we're using it and being able to bring new data out from that, hopefully every month.
Yeah, and that will be great because learning that it has other things in there as well, like opioid and other related events. I think if you can incorporate that to your report, like those kind of whatever relevant data to our town, I guess. I mean, state level data is good to have, but I don't know how relevant it is to what we do here. But if you can find town level data, that would be awesome.
Yeah, and some data, the only data that we can get is state data because just availability, it's how they track the cases. So, where we can break it down to the smaller, more applicable groups, we will. And I will say, we've gotten a new grant, an overdose data to action grant that we're going to be partners with the City of Hartford on that should allow more data to come out about opioids to actually take action on that. So that data to action component is something that we're looking for.
All right. Thank you, Charlie. And sorry, I forgot to call you.
Nah, they're very easy to forget.
You were online. I didn't have the screen in front of me, so I apologize. Thank you for the report.
All right.
Appreciate it.
Have a good night.
You as well. Thanks. Moving on, new business item. We had one remaining item, I think, the approval of the dates, right? So,
Move to approve the proposed schedule for 2024 meeting dates for Public Safety Committee.
Second?
all in favor?
Aye.
Aye. So before we close, I just wanted to thank everyone for, especially Chief Klett and Daniel, who was a big part of putting together that executive summary report. Dave out there for Aetna, and Chief Goodrich and his team, who are in the process of like putting this together for next month, and Chief Gary, who's not here, but I think he's also aligned with what we are trying to do here on the executive deck side of things. And so I really want to thank everyone here on putting it together, trying to align to something which we can use to the benefit of the people out there listening, and it summarizes everything we do here to the best possible extent possible, right? So thank you so much for doing that and working with me on this. One last thing I'll say, there was this rainstorm yesterday into today, and I want to thank all of you. I've been keeping track with our town manager, Ray Carpentino, and I just want to thank the whole public safety community here in this building and outside who have been on top of it. This has been like the second weather event in the last 2 weeks, if I remember, where we had to mobilize. So I just wanted to thank you all before we end the meeting tonight. Again, much appreciated. Do I have a motion to adjourn?
You do. So moved.
Second?
All in favor?
Aye.
Aye.